and Ranking Member Blumenthal for this hearing. And thank you, Mr. Secretary, for being here and for your testimony. As many others have done, I'd also like to take a moment to reflect on the fact that Alex Pretti, a nurse who worked at the VA and cared for our nation's veterans in the ICU, was killed this weekend by masked federal agents in an outrageous escalation of unacceptable behavior by this administration in recent weeks. We urgently need additional oversight and reform over ICE's behavior, because what is happening right now in Minnesota and in states across the country is making us less safe, and it needs to stop right now. So I hope my colleagues on the other side of the aisle will work with us to keep the government funded and protect basic American freedoms. And I will add, Mr. Secretary, that you mentioned an investigation. When there are officer-involved shootings in any other law enforcement agency in this country, pretty much local or state, the officers involved are put on administrative leave, and an outside agency comes and does the investigation. So those things need to happen. The roving patrols need to get out of Minnesota while they mourn these deaths and while the investigation is pending. Now, Secretary Collins, to the business of today. I'm going to ask you a question that I asked a VA official who came before this committee in December, and I'm hoping that you'll have more information to provide than he did. Last May, President Trump signed an executive order that required you to direct a feasibility study and create an action plan regarding bringing a full-service VA hospital to New Hampshire. The action plan was due to the President last November. In a November 20th letter, my New Hampshire colleagues and I asked you to make that action plan publicly available by December 1st so that my constituents can review it and give their input. Secretary Collins, when will this action plan be made available for Granite Staters to look at and provide feedback?
Senator, there's no one else more anxious to get that action plan than I, and at this point we're still putting it together. I think that is the Undersecretary's role to this. So there was some setback during the shutdown that did delay this action. I'm hoping to get, frankly, I'm hoping to get it to you as soon as possible.
Well, that would be good, because it is way overdue, even understanding that the shutdown. And people, and seeing it up there as well. Yeah, it was good to have you up there, but the need is there. People are anxious to consult with you all. Now, you and I have previously discussed staffing at the VA and the need to make sure that our veterans have the best staff and the right number of staff to ensure that they get the highest quality of care. You all have talked about that today. It's recently come to light that the VA is planning to permanently eliminate up to 35,000 positions, most of which are currently vacant, including doctor and nurse positions. The doctors and nurses aren't overhead. They're doctors and nurses. So this is in addition to the nearly 30,000 employees that VA lost last year. In an article discussing this plan and other VA actions, one VA nurse was quoted as saying, "We're going to continue to do more with less. We're going to continue to be overworked." So I'm concerned that these staffing cuts could leave the department in a position where it may not be able to care for our veterans moving forward, especially as more PACT Act veterans come forward to receive more care. And frankly, Senator Tuberville's chart raised more questions than it answered. So, Secretary, what analysis has the VA done to ensure that the elimination of these positions will not affect veteran health care, not just now, but in the future as well?
Thank you, Senator. And that's why my HR person is here, and also Greg Goins from a practical center will explain that to you.
Okay, quickly, please.
Senator, I'll start off. I want to make sure again that we don't conflate personnel and authorizations or positions when we talk about that. When we talk about that, and Mr. Goins mentioned a little earlier, for years we've had a process. Congress, you yourselves have been asking us for years to produce a unit manning document to provide position numbers, structure, how we're organized. The VA hasn't done that.
I'm just trying to, sir, I'm running out of time and I have one more question. So sure. I'm just trying to understand what the process is.
We have a very detailed process. We put this in the hand of our operators, the VHA, who determine the requirements. What they are doing is going through and identifying what they need. We are removing empty, vacant billets that have been created at a very low level many times, that have been put on the book for years, that have no funding, no authorization from you to fund, that have been just sitting out there that are masquerading as
all right,
billets.
I will follow up with you on that. I will also say, when there's a lot of uncertainty and a lot of announcements of layoffs and cancellation of contracts and back and forth, it doesn't make people eager to come work at the VA.
That's correct. Now, and if I can just add one thing, Senator.
I've only got a few seconds left, and I got to get to this next next page because it's relevant to what you just said. As part of the changes that VA is undergoing, I understand that you're also looking at placing caps on the number of employees that each VISN can hire. That was something that was confirmed during committee discussions in preparation for this hearing. So I'm concerned that these caps will affect the number of employees that can be hired for new or expanded VA facilities, like a new hospital in New Hampshire. So, Mr. Secretary, will you commit to hiring more staff to support the expanded care and services that will be available for Granite Staters, we hope, when this full-service hospital finally comes online?
Yeah, I would be happy to let Greg answer that because he's actually had experience with what you're just talking
Okay.
about.
So this goes back to what I was talking about when Senator Tuberville put up the chart.
Yeah.
We have never had a strategic approach to enterprise resource allocation to do exactly what you're asking for. The reason that we have asked our operators in the field, and that's our medical center directors and their executive leadership teams, to evaluate people on board and number of vacancies, whether they're in recruitment or not.
So yes or no, caps on number, because look, I've managed large organizations too, right?
Yes.
And here's the deal. You analyze from the bottom up. You don't put arbitrary caps from the top down.
Right, but you also do an affordability. Any business in the entire free world, you can't just keep adding resources if the demand against
We're not
those
a
resources.
business. This is a care agency for the people who gave us our freedom, and they deserve every investment we can give them. And I am proud to work with my colleagues on both sides of the aisles, but we need to put our money where our mouths are and protect the people who protected us. Thank you.
You're correct. My time in Afghanistan and both of my brothers being deployed in the same theater says the same thing on my end. But the point is, when you have a new hospital that comes into New Hampshire, as an enterprise, if we don't have a strategy to be able to look at your people and say, here's the resources to run it, you're robbing Peter to pay Paul. That has to be fixed.
The strategy is fine. Arbitrary caps, which were described to our committee staff, are not. Thank
Senator,
you.
may I, if I can address the caps? When we talk about it, and I mentioned before we didn't have a unit manning document, and I know this a little bit in the weeds, but what we had to do is start creating that. How do you create your structure, to what Mr. Goins was saying? So what we did is we asked what the requirements were for VHA. So for example, they came back and said, we need 1,000 people. I'm just saying, right?
Example,
So
right.
basically, they said this is our requirement. Now, if I set my requirement at 1,000, okay, I can't put 1,000 positions on the books because I'm going to have a lapse. That lapse rate is somewhere generally between 7 and 9%.
Right.
So what we did is we took their requirement, which is, let's say, 1,000. We inflated that by about 9% for VHA to say this is now your authorization, your UMD, so we can create an initial UMD. That cap was set at the requested authorization by VHA to do their mission.
Thank you for the clarification. I'll follow up with you because what's really important here, obviously, and I will take you all at your word, is that we have the services and the care for veterans that we need.
Yes, Senator.
And look, you guys got off to a start where you did arbitrary, you announced a huge number of layoffs, a huge number of cancellations, and we couldn't get any information about any process behind it. So you're at a trust deficit with us right now.
Senator Sullivan.